It's hammer time. That was surprisingly pleasant. That is very effective, whatever it is that you're doing right now. In case he needs one, I have an extra one.
I think he uses a different size.
It's not all about the size, baby.
How you use this?
No! Perfect. Dr. Beau Hightower's thumbs are in me. He knows what he's doing. Your knowledge is strong and your thumb is strong.
What's going on out there in YouTube land? Today I'm with the best orthopedic surgeon in Orange County, California. He treats all your favorite MMA fighters. He works with Rafael dos Anjos. You've seen him probably with Chris Cyborg. You've seen him with Tony Ferguson. I mean, this guy takes care of the literal who's who of MMA. His credentials go on and on and on and on. You know, he was top of his class at UC Irvine at the medical school. He was at the LA orthopedic surgery residency. That was at the old haunted building, right?
Yeah. Well, now it's haunted, yeah.
Yeah. I've been watching his clips. Orthopedic surgeon extraordinaire, subspecialty. He's also done sports medicine. He does regenerative medicine, conservative surgery. He's also the guy that created the world's greatest shoulder stretches. So I'm going to drop his YouTube link below here. If you guys want to find those out, if you want to work on your shoulder, figure out ways to avoid surgery, avoid having to see torture therapists like myself, go over there, show him some love, subscribe to him, and you can check those stretches out for yourself.
Very good. Hey, thanks a lot. Thank you very much for coming by. It's great. You know, we're here for a special reason, of course, not just for me to give you a tour of the place and to talk MMA injuries and stuff, but my knee wants to give you a rematch.
Okay.
You know that, right?
Yeah.
Okay. And then maybe we'll do a little thumb wrestling, maybe?
Oh, man. The challenge has been thrown down. We're going to do it, but it's going to be at the end of the video, so don't look now.
Yeah.
All right, let's go.
All right. So what are we doing today?
All right, so we're working on the muscles in your neck. So turn your head to the left all the way for me, and then to the right all the way, and then back to center. Look down all the way. Tight there.
A little bit tighter, actually.
You can't bring your chin to your chest?
This way. This is my good side. This is my. How's it look?
This is model side. Bring your chin to your chest for me. He's not all just good looks. I mean, the guy's got the biggest brain in like I said, in Orange County. It's been well documented. Look up to the ceiling, and then back down.
Do you feel the cracking?
I don't.
Do that? Yeah.
You have some crepitus in there?
Yeah, a little bit.
A little crunchy?
Just a little bit.
All right, Doc, so you're an immigrant to this country, so you were born in Peru, so we'll get into the story about your knee in a little while, but starting out, tell us how you got into medicine, what made you want to become a medical doctor, and then along that course, like what made you want to become an orthopedic surgeon?
Is your thumb like a truth serum thing?
It's supposed to be.
Okay.
It's like the lasso of truth, that's my thumb.
Like if you don't hear the truth, you dig it deeper?
Exactly.
Okay, that's what I figure you're doing.
Yeah,
okay. So my story is a little different than most. I grew up in Peru. I was there for 7 years, and while I was there, I was taken to a soccer game, and just like any third world country, the kids are out in the street playing while the adults are in the stadium drinking or whatever. Actually, that's not what, they weren't drinking. But I was on the street, and I was playing this game, you know, it's like smash the can game with my friends, and I was 3 or 4, and putting down the cans on the street. There's a highway, actually, and then the cars come by and run it over. It's entertainment for us back then. You know, we didn't have the internet back then. So the cars would smash these cans, and there was one occasion where I slipped on gravel and I didn't make it to the other side, and a bus ran me over. So a commuter bus ran both of my legs over. Just went over both legs, mangled them, and I had open fractures, open bilateral and leg fractures, or mangled extremities, basically. So that was my introduction to being an orthopedic patient.
So doctors obviously saved your life then, right?
They did. You know, it was still a complicated thing because I ended up getting infected and I had huge open wounds, and I made it through that, and my legs at least healed through the initial trauma. But over the ensuing years, one of my legs started growing crooked. It starts going east while I'm moving west. So as I'm getting older, one of my legs is seemingly getting shorter, but it's because it wasn't growing. So it wasn't growing. Not only that,
and it's just because you had damage of growth plates.
Yeah, I had growth plate damage. So the growth plates are the areas where most of the growth occurs in your body. So that's where the axial or longitudinal growth occurs, and in us, most of the growth occurs in our femur. That's what makes us tall.
Right.
So my leg was stunted. It was stunted, and by the time I was, like 11, I had one leg that was 9 centimeters shorter than the other, or longer. It was that much shorter, and far out. So anyways, I ended up having a lot of surgeries, and I met some great doctors at Shriners Hospital. That was my first introduction to orthopedic surgeons. They took care of my complication. I had leg lengthening done. That meant that this short leg was made longer, but I actually also had leg shortening done. So see, I had leg shortening on one side and leg lengthening on the other, so that I'd be better balanced, actually. So the reality is, like, I'm actually a 6'2" person. Yeah.
Me too.
Yeah. I mean, that's what I would tell, people at bars. You're talking to a 6'2" guy.
Yeah.
For me, I was actually genetically destined to be a 6'2" guy. And that's why I have daughters actually that are tall.
Okay.
But
so
my legs
you were
are actually
supposed
short.
to be in the Lakers.
Yeah. Well, at least in the Peruvian basketball team.
There you go.
Okay. So one leg was short and crooked, and the other leg was shortened. And then I ended up having a leg lengthening done. Actually, I had a leg straightening done first, where the femur had to be straightened out. And anyways, I had a bunch of operations that allowed me to be where I am today. So I have to say that because of orthopedic surgery and because of the charitable work from Shriners Hospital, that is what's allowed me to take care of so many people. So it's like, this ripple effect, where one little ripple as a helping hand creates many more ripples. And and I feel that everybody that I help, including some of the pro fighters and Olympians, are actually it's a translation of what happened to me, receiving help. The same help is just being recycled over and over and over. That's kind of how I see it.
So for everybody studying for their boards out there, if you have a fracture through the diaphysis, metaphysis, and epiphysis, what grade of Salter-Harris is that?
A Salter-Harris is only a fracture of the growth plate. So you can have like a non-displaced fracture, which is a type 1 or a strain, and then 2 is a little chip, and 3 is another little type of chip. So it just depends on how severe the fracture is through the growth plate. So for me, mine was open fracture, Salter-Harris fracture over here, and then the way they tried to fix it was with like wiring, so that kind of made things even worse in the end.
Okay.
So yeah, Salter-Harris. Adults don't get Salter-Harris fractures, by the way, just kids. So little kids that fall on their wrists, they get Salter-Harris fractures all the time. So they actually heal really fast, but you do have to be careful about growth plate abnormalities later on. Yeah, and it actually comes in play with ACL reconstruction. You'll have a 10-year-old or 11-year-old kid who sustains an ACL tear. Well, it's an isolated ACL tear, but when you operate on it, you actually have to go through the growth plate if you operate on it the way we do with adults. So when you operate on a child or a growing person, skeletally immature, you have to be mindful that you may end up damaging their growth plates. So you don't want to have to deal with a child that ends up having a short leg or a crooked leg later on. So you use alternative techniques.
Wow.
Yeah, pretty cool.
Salter is the biggest brain in Orange County.
That's pretty cool, right?
Yeah,
Kinda
absolutely.
Right?
I find it interesting.
So you want to know how leg lengthening is done? So it's really interesting. Leg lengthening has been done for a long time. So that means that a leg or an arm actually, or a bone actually, is made longer than it is. And it's done through traction or stretching. So it's very medieval. You tie the person's arms over here and you tie it over there to a machine, and then you go like this. You go, and you hear the chains go. Sounds like a haunted. I'm just kidding. Okay.
Got her! You guys can see the look on my wife's face right now.
Okay. It's actually almost like that. So what they do is, and I had a technique that was developed by a German named Wagner, Heinz Wagner. So it's actually a Wagner device, which is just basically a telescoping device, like a telescope, but it's a stainless steel metal rod-like. And and it has 2 pin holders. So what they do is, or what I do, to be quite honest, because I can do it too now. It's what I had done. You drive 2 pins into the femur bone in the near and the far ends. 2 big pins, so big pins like this into the bone. 2 of them parallel, and then you make another incision in the center of the bone, and you take a saw and you cut the bone. Okay. But you don't cut the bone until the pins are in, until this device is on. That way the leg doesn't collapse. So then you put your device on, and then you cut the bone in half. You close the wound, say a prayer, and then you send the patient home with some instructions. Okay, so these are the instructions. These are my instructions. There's a knob at the end of this device, this Wagner device, and you have to turn it. It's like a stereo volume dial. And you go, you turn it every day. A full revolution is 1 millimeter distance. So the rod then will telescope open, and as it telescopes open 1 millimeter a day, the bone is separating in the middle because it's been cut or osteotomized. So then over time the gap goes from 1 millimeter to 10 millimeters to as long as the leg can tolerate, because it can't go forever, because you'll damage nerves and you'll damage arteries because you can't go forever. So then you get to a point where maybe you reach the length of the other side, so in my case it came pretty close. So it's still a little short, And then you stop the stretching or the traction every day, and it would make noise. It would go. I mean, you can literally hear it. Hear the separation happens, and then you wait until the gap heals up, and so bone will actually form in between the bone. There will be new bone forming, and that's the magic of our human bodies. Is we can literally damage our bodies either with a knife or a car, but the body wants to heal itself, and that's the amazing part about what we do here with leg lengthening is we damage the bone, we separate the bone, we keep it in place, and it grows bone in the middle, and now you have a longer leg.
So for all you bros out there complaining about being short and wanting to grow and seeing this procedure, think about that real hard before you sign up for it.
Well, it's kind of like a stigma in the little people world. So there are some little people that want to be taller, and they have used this technology to actually for aesthetic purposes, to make them reach about average height.
Okay.
Yeah.
There was a heated discussion on one of the comments on my Instagram early on in the pandemic for the My Sharona Cyrus. A friend of mine who I don't think graduated high school was telling you to educate yourself. You want to explain to them how much formal education you have and how well you did in school and, some of your accolades.
Well, I think that to start out with, I think it's important to say that
this is time to brag.
Education and experience matters. I mean, education and experience matters.
Tell them how smart you are.
I'm not bragging. I mean, we it's hard to get into orthopedic surgery.
You worked hard, man. Tell them what you
I'll
did.
tell you how hard I worked. Yeah, 4 a.m, man. Studied till 4 a.m. Didn't sleep. That's right. It was hard. Okay, it was really, really hard. And to be top of your class.
Go back to undergrad for me.
Well,
what did you study in undergrad?
I studied actually. It was biology and biochemistry. I love biochemistry and biology. But biochemistry actually was a lot more exciting, actually. So, but you know what? One thing I want to say before I tell you that I've been in school I was in school for 15 years, and I've been doing this for 20 years. For people that want to do medicine, and for people that don't have a lot of money, look, it's doable. You just have to go to a junior college or city college, which is, believe it or not, where I started. Okay, so you can be a big fish in a little pond, so to speak. Because it's smaller colleges, and you can do well. And then you transfer over to 4-year university, like a state university. And it's expensive, but not terribly expensive, and that's what I did as well. Cal State Fullerton College, Cal State Fullerton. I was a Hornet, and then a Titan, and then I became an Anteater at UC Irvine College of Medicine. And it's not easy getting into a California school. I thought I was going to get into New York. I mean, I did get into other schools, but I just wanted to stay in California. And then I got into LA County USC. So it's a stepping stone upwards every time in terms of the quality of education. And in order to become,
what he's not saying is he was at the top of every single one. That's how hard it was.
You have to be.
Each of these stages.
You have to be. I mean, if you want to do orthopedics, brain surgery, orthopedics, urology, you just have to be, because they're great fields. I mean, look how fun they are, right? I mean, we hammer, we drill, we cut, we beat. I mean, we smack. Hammer time. Right.
Next thing you know, you're getting into the UFC fighter booth.
Yeah.
Michael Bisping
Right.
backstage at the Conor McGregor Dustin Poirier fight. I mean, these are the perks of the job. So I mean, if that's something you want to get into, Doc here is kind of laying out the blueprint of how to do that.
Yeah. You know what? I always say I have a blueprint. Okay, I have a blueprint, and it starts with work hard, work harder than everybody else. If you want to achieve what others haven't achieved, you got to do what others refuse to do. Okay, that's work hard. Okay. But you didn't mention gold medalist.
Wow.
So yeah, I got a gold medalist on my resume now. That's right.
Wow.
David Taylor, Magic Man.
Wow.
David Taylor, ACL. He posted it, so I can say it.
Boom.
Right.
There you go.
Bam.
Bam.
That's the best
board.
thing. That's actually like one of the greatest accomplishments, other than being Alpha Omega Alpha, which is the honor society, and being in top of a class, and being in orthopedics and having this awesome practice. I think
it's smelling amazing, by the way.
Oh, thank you. It's Nordstrom's. I call it the closer.
And you guys should see his sock game too.
I call it the closer.
He doesn't do anything halfway. Let's just say that.
You put on the good cologne. You got a nice shirt on, a gold necklace. They're going to sign up for surgery.
There you go.
Almost. I mean,
who knew?
Yeah, that's a secret.
Well, what you don't know is a lot of folks, he actually doesn't want to operate unless it's really medically necessary, which is, not everybody practices that way. So he really goes above and beyond to try to find conservative approaches first. But obviously, when you medically need it, you medically need it. Doc is one of the best in the game at being able to decide which patient goes into which category.
Well, that's the art of medicine. A lot of people, they like to gauge the doctor's success, or they like to comment on how great they are based on how good they do surgery. but surgery is just part of it. Surgery is a technical component of of a treatment.
Sure.
The hardest part is knowing what the diagnosis is and making sure that you're prescribing the correct medication for that diagnosis. So the hardest part about practicing medicine, and for me, I think, is nailing the diagnosis, figuring out which of the many potential abnormalities on an MRI report is the one that's causing you the problem, and then making sure that you prescribe the right medicine. And sometimes, believe it or not, it's not hot lamps and cold steel. Sometimes it's this. Sometimes it's deep tissue work, fascial release, joint mobilization. That's why I have on YouTube Steve Mora, MD's 6 best shoulder exercises, world famous ones, because
it's in the description. Subscribe to his channel.
Because I've actually cured so many people with those stretches. It's really funny. That and some soft tissue work, especially people with a lot of arthritis in their shoulder. You don't need to go at them with a needle or a knife.
And he has plenty of work, guys. So, there's a lot of stuff out here with medicine right now, and they're like, oh, they're just after money. He wouldn't be doing that. He's got plenty of other work. He would rather you not be in his office. I promise there's plenty of work for him. So, that stigma saying that these physicians and these companies are only after money, that's not true at all. These guys have your best interest in mind, so listen to them, please.
Yeah, I think that's, operating on someone that doesn't need surgery, it's like the worst thing you can possibly do. And then, of course, operating on them and not hitting a home run is also not a good thing. So you have to know what you're doing, obviously, and making sure you choose the right patient.
Well, like we always talk about, like with the invasiveness, the risk and the benefit go up drastically, right? So when I'm doing soft tissue, the risk is really low. The benefit is good for a very superficial issue. But if there's something serious going on, the only risk I run is delaying care to going where they need to go. It's not going to make it so much worse. But if you do a surgery on something that doesn't need it, that's lifetime, structural changes. Yeah. So that's why it takes somebody who's got such a big brain to be able to decipher who goes when and where. So you have been working with Dr. Kessler over at OC Fight Docs for a while, right? Is he how you opened the door into MMA? Do I remember that story correctly?
Yeah, it was really interesting. So Dr. Kessler is a buddy of mine, a local chiropractor, William Kessler. He's at Kessler Family Wellness. So I saw him at a mall one time. He was doing some marketing thing at a mall. I can't remember what he was doing, and I took his business card, and eventually we communicated, and he came to my office, and he came to my office like 12 years ago. And he's like, Doc, yeah, man, I've been doing this, taking care of these MMA fighters. It's a good business. It's where sports is going. And not a lot of people knew about MMA back then.
Sure.
So he's like, come to my office. I have an office at No Limits Gym in Irvine. So it's like your place, It's
sure.
a medical office within a gym. So No Limits Gym was a big MMA gym. Rampage Jackson used to train there. Robert Emerson was another old fighter from Huntington Beach that used to train there, as well as some other people. So then I started to go, and I started doing boxing. Not real boxing where people are going to hit my face. I don't need anybody hitting this face. So I was just like, cardio kickboxing and doing that stuff,
Sure.
And so Kessler was there, and I got introduced to Rampage and these other fighters, and they hadn't met an orthopedic surgeon before. At least at that time they hadn't. So then they met me. I befriended them, and they became my patients. A lot of them became my patients, and then I've collaborated a lot with Kessler and taking care of patients as well. So it just grew from there, like word of mouth. And before you know it, I was taking care of a lot of UFC fighters, but I also take care of a lot of police officers too. It kind of goes hand in hand because they have similar type of injuries. So that's my niche. But mostly MMA fighters, man, because they get hurt. They get hurt all the time. And they need help. They need someone to be there with them to get them through this hard time. And traditional medical structures, they're not designed to help the pro athlete navigate through things the way they need. They don't need a visit like every 2 months, and they need to figure out how to get better fast so that they can make money for their family fast. And sometimes they have insurance, sometimes they don't. So I've been able to create an environment or a machine that allows me to be connected with my patients, especially those that need a little extra love to help them get through the hump so they can get back in the ring and fight.
Yeah, and you took care of one of our dear friends, Jody Escobar, who's a fighter. It's funny you mentioned that because one of our other friends, Michelle Waterson, she had broken her hand, and I don't, no disrespect to wherever she went, but the care they didn't plate her when they should have. and she kept re-breaking her hand over and over again. And basically the question that came up in the clinical examination was, well, you know, what else do you do? And like, no, this is a professional athlete. Like, she needs to come back. And whether it was because she was a female or maybe she wasn't assertive enough or wherever she was, basically, obviously, she ended up having to get it plated later on after 3 fractures. And sometimes, you know, if you're used to a general population and you don't have that sports medicine background or you haven't been aware of MMA, sometimes you're going to treat them just like, you know, mom that fell down and broke her hand. And that's not what these really high-level athletes need. No. They need specificity. They need somebody that understands, you know, how to get them back quickly and can really relate to them in that circumstances where what kind of care they need specifically for fighters.
This one goes in. This one stalls a little bit.
Can you tell where it's coming from?
You know, I think it's part of maybe the neck, maybe my posterior scapula, maybe. There's a little tightness somewhere.
Okay, so passive.
Yeah, right. yeah. It goes up, but there's resistance. Like right about here, I can feel a little resistance.
So I'm going to pull your scapula back a little, do the same thing again.
Yeah, that takes away the resistance.
That clears it a little bit?
Yeah. Scapulothoracic action all around here.
Oh, yeah. Right there, huh?
Oh, yeah, right there. Dr. Beau Hightower's thumbs are in me. Uh-oh, here comes the big tools are coming. It's hammer time. I'm pretty sure it's hammer time. In case he needs one, I have an extra one. I brought it just for this.
Yeah, I think he uses a different size one.
It's great. It's all about the size, baby.
How you use this. Yeah, I know. You know.
So you want me to show you what this knee does and what it doesn't do? So if you look at it from there, number one, it's got atrophy compared to this one. This femur is actually still shorter than that femur. You can't tell from that view, but it is. And the other thing is, this knee actually does not bend. No matter how hard, you'd have to break it, literally. It does not bend. And so that's a post-traumatic arthritis. That's pretty much what happened. That's what happens when a bus goes over your legs. Hey, can you check my my SI joint like you do all the time when you have people prone and then you have them raise their leg and then you bash their SI joint a little bit and then you say, let me see you move your leg again. They're like, oh my God, I haven't moved it like that in so long.
Pull that shoulder blade back. Pull it back a little more. A little more. Good.
That was surprisingly pleasant.
There.
It feels good actually, you know, overall.
Can you bring that bicep all the way to the ear yet?
Yeah, but it is a little bit soft. It doesn't. I don't have that same resistance from here to here that I had before.
Yeah,
so I just feel better.
Let me have you.
Maybe a little bit more massage. Maybe like a little bit over here to this side. Maybe you can scratch my back a little bit too while you're there.
Maybe lay your back with your head on that side. Over here. I'm just gonna traction this side a little bit.
Oh yeah. See, you do what I do. I mean, well, it's not what I do. I ask people to do this for them. Soft tissue work, stretching. I've been teaching patients how to do hanging stretches with their arms. Mm-hmm. So to make it less complicated, some people have a hard time following my instructions, you know, my world famous 6th grade stretches. So I tell them, okay, just grab an object and use your body weight to try to pull your arms straight. Hanging therapy, and it's made a big difference for people with arthritis of their shoulder. Huge difference. It's so easy to do. So it's almost what you're doing when you're pulling my arm, and but these folks can do it without another human helping them.
So we're good up here. I'm just feeling a little there.
Yeah.
Slowly walk your feet so your chest goes towards that wall. So small steps with your feet. Good. Come back to me. And then I'm gonna lock in there again. Go ahead and walk that way again.
Oh yeah,
back to me again.
That's nice.
And go ahead.
Oh yeah.
Walk with your feet, small steps. Really small steps again. Perfect.
Yeah, it feels good.
So
feels good.
There it is.
Yeah. That feels nice.
Yeah.
Feels the same as this.
That's
That's interesting. It's a little tight.
Yeah.
Yeah, that's awesome. Thank you. Great job.
Yeah. You're solid.
He knows what he's doing.
Nothing I did on you right there, I learned in chiropractic college.
I know.
Not a single bit of it.
I bet.
So
I know.
That's where you say, okay, this is my baseline, and this is just where we start, right? And so what did I learn in school that I'm pretty effective with? Fixated ribs, you know.
Yeah.
Doing a physical exam, you know, knowing who not to treat.
Yeah.
And that's really what the first 4 years is, knowing what not to do. Do no harm. And then from there, you've got to go out on your own and you know, assess, get more degrees. So for me, it was getting a master's in exercise science, getting a doctorate in naturopathy, and just adding more layers on. So if you're going to do conservative therapy, don't you want to be good at it, right?
Yeah. No, you're right. A lot of things we learned the foundation, you know, like taking anatomy at school when I was in med school. Mm-hmm. I learned that the arteries and the nerves are closer than you think. I mean, you're like, holy shit. It's a big vessel. You know, like you don't want to see those vessels ever again. Like if I do a clavicle plating, I know that the subclavian arteries, right, is very, 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 very near. And if it gets nicked, it's going to disappear on me, and it's going to be a problem. So you learn the foundation that's going to help you navigate medicine and not hurt people.
All right, let's lay your stomach and check your side joint.
Okay.
Do you have one that bothers you more?
You know, yeah, the left one. Actually, the one you had your finger on. That
Right
that
there?
spot right there. I don't even know why it hurts. It's weird.
It's almost like your legs go into your pelvis.
I don't know.
You have the world's ugliest knee,
I
and
don't think
shockingly, you
it
have
had
SI
to do-
joint dysfunction on the same side.
It had nothing to do with the bus.
Yeah, right.
Right.
Uh-huh.
I don't know why that side is all messed up, man.
So
Yeah, right spot right there.
Let's extend
It's
this
really
leg
weird.
up all the way. Okay, other side now. Yeah, the movement's actually good. It's almost hypermobile.
Well, it's because it compensates because the other leg doesn't move as much, so
Yeah,
this
I
leg has
understand.
to be able to lift and do a lot more.
Because I expected that one to go shorter, and it's not.
Yeah, my shorty, the right one is the shorty.
So it's right in there.
Right there, like a little bit too. Yeah, that spot.
It's right on the PSIS.
Right there. Yeah, it's really weird.
Yeah.
It's like a very painful joint. That one is not so much. It's almost inflamed.
Do you feel it when you're walking?
Sometimes there's a
massage?
quick. No, you know where I feel it is. Every once in a while, I'll get out of bed and I'll lift one leg up to put it to move it over, you know, to get on the ground.
Mm-hmm.
And then as soon as I lift up the right leg, something will click. That feels really good.
Okay. Raise that right one again. Harder. It's harder to do when I'm.
When you're pulling my skin off?
Yeah.
Yeah.
Yeah, do the left one again. And that one's still the same? Still. I'm gonna let go of it. Do it again.
No, it helps when you pull the skin because I think helping it out a little bit, I think.
Do the right one again without me. And then drop it down. And then I'm gonna lift that again. Do it again. Yeah.
So are you just checking to see if the fascia is stuck on something?
Yeah.
Okay.
Yeah, right there, huh?
Yeah.
So I'm just gonna hold that one for about 30 seconds or
Okay.
so. So I can actually now, you know, through a lot of clinical practice with the pinwheel, I can actually tell by touch, by feel through the pinwheel, like where people are having nerve entrapments.
Oh, really?
So it must have to do with the tone of the tissue, or you know.
Yeah.
But I'm like, oh wow, that's probably numb right there, and you can actually paint the dermatome, and like, so I'm actually feeling it through the metal now subconsciously.
Oh.
Like my brain is now adapted to be able to feel that, which is crazy.
The pressure or the
Just the abnormality.
Yeah.
You know, which makes sense because we can drive a car, not even paying attention and not even remembering how you got where you were going. Your subconscious brain just took you everywhere you needed to go. We're talking like we're not putting together every syllable, every word necessarily. Like your subconscious brain is like, oh, I can do that.
You reach Jedi level.
All right, raise that leg
All
up
right.
again.
Ah.
Pretty good. Back down. Yeah, let me get I'm gonna add a little rotation to it. So drop it. Put it down. I'm gonna get to right there. Think super happy thoughts.
Yeah. Yes, it was interesting. It's a little spot.
So I'm gonna do a little bit right there too.
That is very effective, whatever it is that you're doing right now.
Yeah.
No, I can feel that it's a solid hit. Like nice and solid.
Try again. And right side.
See, what's nice is it
pretty good.
doesn't. See, it's not hurting now.
Okay.
I'm not sure about the height,
Right.
but that pain that was right there where your finger is at, that pain is gone
Nice.
actually. Yeah. Feels good. Actually, that actually felt really good. Man, I'm gonna be so good for tomorrow.
Yeah.
That actually feels really good. Yeah. Yeah.
I'm just gonna get a T-spine middle bottom. So let's stand right here. So you can put both hands right here. I'm gonna hook in there. Bring your elbows in a little and look up.
Ah!
Perfect. Very crispy.
That was good.
He's like, that was good. I'm
That
still
felt
here.
good. Yeah, that was good. Man, we gotta practice that one.
You go and sit right here. And then go hand on hip like that with this right side. And then pull that elbow straight back.
What'd you say?
Sassy hip. So pull straight back.
I'm not always this funny, okay?
He's pretty hilarious.
Yeah.
Pull back hard.
I mean, when it's time.
So hang on.
Yeah.
Pull.
Oh, yeah, there you go. That was good. That was an easy one.
Yeah.
Oh,
I'm gonna check this
jeez.
one too. So let's go right there. And block
Little
there.
cheater crack.
Pull.
Right. Oh.
There you go.
Wow. Did you hear that? Who was that? Was that you?
So that one was AC.
That was good. Really? Can I show it to you?
Yeah, let's see it.
Okay.
Roll that thing up.
Drum roll, please. It's like a little striptease.
Somebody stop me.
I wear this. This is actually a really nice sleeve, by the way. For people that have like arthritis, knee arthritis, and they have nighttime pain. I'm not getting paid by them, just so you know, but it's called Reparal.
Okay.
But it's actually a really nice, high quality sleeve. It goes all the way to here. That way, it gives me my knee a little bit of support. And
So this is what got him
feels good.
into medicine and into surgery.
yeah, this is it. This is what I call my baby leg here. So.
Okay.
So just so you know what these scars are, some of them, because I think they're kind of interesting.
And by the way, he works out all the time. He lifts weight. He stays active. Obviously, you can see these biceps. So a lot of people would just accept this and say, "Hey, it hurts. I can't do anything." But a guy like Dr. Mora is somebody you should look up to. He says, "Hey, there are no limitations for this." And while there are some limitations, he's not running. He's still activating the muscle. He's staying healthy, and he's not using this as an excuse to gain weight and be lazy. In fact, he knows the opposite is true. He's got to work even harder to make sure that he stays moving and stays looking young and beautiful, and that nice salt and pepper color he's got in his hair. And
Well, it'll be gone tomorrow.
ah!
But the reality is, that's true though. It is true. We have a lot of people are dealing with physical issues, mental physical issues that have affected them throughout their lives, and some people see those issues as weaknesses. But if anything, I mean, it's philosophical here, but for the most part, they can strengthen you in the end. They can strengthen you because you get through a certain experience, or you experience these setbacks and failures, like physical or exercise failures or whatever.
Or whatever, academic.
Whatever it is.
Whatever it is,
And, you got to just look at it as an exercise, like the same way that we exercise our biceps to get strong. We break them down a little bit. Well, this is a breakdown. It broke me down, and it still affects me every day. But at the same time, if you just give up, if you just throw the towel in the ring and give up, then you're going to be in a world of hurt. You're going to be in a world of hurt because then you get into this downward spiral that starts with gaining weight, and then then you start to get stiff, and then you start to look like there's something wrong because you're stiff. You're not walking upright anymore. And the weight gain hurts, causes more pain, and then you get emotionally depressed, and then you just want to stay home and eat Doritos and play games, video games, and smoke pot, and that's all you want to do, because you get depressed. So you have to just see your weakness or your failure or your disability as a learning lesson in life, and you know what? It's going to hurt. Exercise hurts. Exercise hurts me. Exercise hurts. I hurt every day. I'm not complaining about it, but it's just a reminder for me that I have to stay fit, and I try to pass on the same lessons to my patients. So I tell them, look, I know your knees hurt, and I know you can't do jiu-jitsu now, but maybe you can do battle ropes. I'm not saying stay home and get on a rocking chair. Opposite. I say, look, you got to stretch. You can do battle ropes. You can do upper extremity bike, and you watch your portions. You have to change. You have to modify, and you have to adapt. And by adapting, you get stronger. So that's pretty much what I try to do. It's something that makes me adapt as much, and it's a constant process, all the time.
And take that as a lesson. And so I've actually worked on Doc before. We tried to see if we could do the scar tissue. Not much change, obviously. He's doing lipogems. He's done regenerative medicine, and he does a lot of that here in the office too. He'll do PRP and stuff. So he's not just doing surgeries all the time. He does a lot of proactive regenerative stuff too. So if people are interested in getting a hold of you, where can they find you? You have a website,
Yeah, my website is myorthodoc.com, myorthodoc.com, and I'm on Instagram under my name, Steve Mora, MD.
Go follow him. He's got great stuff there. Here we go. We're ready for you.
Thank you.
Here he is.
You go. See, social media.
Twitter, Instagram,
Steve
YouTube.
Mora, MD. Twitter, my
No
orthodox.
TikTok on there yet, but it's coming.
No, you know,
Documentary.
I don't do the dance thing yet. So
Yeah.
at some point, once I get my
Once we
dance
get this
maneuvers,
SI joint feeling a little better, you might see some dance moves.
Anyways, you can reach out, and you know what I try to do is I provide a lot of educational material, and in the end, the purpose is to be able to provide people education and also hope that that there are people out there that can help them. Just like there's people, you help people with problems. I can help people with problems. At least I think my experience has allowed me to help a lot of people, and that's what I promote on my social media. Not only do I like to shoot nice pictures of myself, just kidding. It's not about that. It's actually about just educating people and hopefully being able to provide information that may change someone's life someday.
And he does a great job of that. So make sure you guys check out his YouTube channel. Go show him some love over there. He's got his practice here in Southern California. So if you guys are in the area and you need a consult, he's also got 7 other docs here that can help you out as well. So it's a really full practice.
Hey, let's do one more thing. Let's do maybe a little thumb wrestling, just for fun.
Okay.
All right, no eye pokes now, all right?
Okay.
1, 2, 3, 4. I declare a thumb war. Okay, we're gonna get ooh. Oh, I'm trying to get there we oh, it might be a tie. Oh. See, we're not giving up. We're not giving up.
Got a tie.
I think we're gonna tie. You know what? Another tie.
She was ready for it.
Another tie. You got a strong thumb. You got a strong thumb.
I'll take it. He has a strong thumb.
Your knowledge is strong and your thumb is strong. Seriously, thank you so much for coming by. Seriously, it was great having you here.
Thank you so much. Make sure you guys go show him some love, and we'll catch you guys on the next one.
Thank you.